Hi guys, welcome to Nutrition of the Soul. In a given year, 1 in 5 adults struggle with a mental health disorder in the United States. This corresponds to 43.8 million people, or 18.5% of the total population. Nevertheless, millions of people are stigmatized, discriminated, and isolated by their families, friends, and even employers because of the widespread myths surrounding mental health. This can make it difficult for a person dealing with a mental illness to recover. It is therefore indispensable to dispel such myths and provide help to those grappling with a mental health disorder, as early diagnosis and intervention can help a person recover completely and lead a normal life. Read on to find out if certain things believed about mental health are myths or not. 1. Myth. Mental illnesses are rare. Fact. Mental health conditions are more common than one can imagine. With 1 in 5 people being affected by it, 1 in 25 of those affected get a diagnosis of a serious mental disorder that impairs life function in a given year. It can affect anyone irrespective of one's gender, age, ethnicity, race, religion, and/or income levels. 2. Myth. A mental disorder is a consequence of poor parenting. Fact. Mental illnesses are not a result of poor childcare practices. It is a common affliction that affects 1 in 5 teens and young adults. Mental health is affected by genetics, environment factors, trauma, and so much more. 3. Myth. People pretend to have a mental illness. Fact. No one chooses to have a physical illness. Likewise, no one chooses to have illness like this. The causes behind this is extensively investigated and are genuine. Sometimes, the symptoms of this might not be visible, however, that does not mean that someone's condition is not real. 4. Myth. Mental health disorders are a result of personal weaknesses. Fact. Just like any other major physical illness, mental health is also not a result of a person's character or personal weaknesses. It is caused by genetics, environmental factors, and lifestyle choices. A stressful marriage, job conditions, or strained relationships can make some people more susceptible to this. Biochemical processes, faulty circuits, and the structure of the brain may also contribute. Long-term consumption of alcohol or drugs also leads to the development of mental illnesses. 5. Myth. You're simply sad, not depressed. Fact. Depression is not something a person can just get rid of. People often tell the depressed one to cheer up or shake it off. However, it is not just the blues that can be willed away. It is a serious mental health disorder which necessitates medication and therapy for proper management. 6. Myth. Medications will help, you do not need therapy. Fact. People with mental illnesses have different treatment requirements. They cannot be treated with a one-size-fits-all approach. The treatment plan for mental disorders should be customized to suit a person's requirements and medical history. People usually benefit from a combination of medications, therapy, and self-care. One must talk to a mental health counselor to know about their options. 7. Myth. Individuals with mental disorders cannot handle school or work. Fact. It could be challenging to handle stressful situations for all people, not just for those living with a mental illness. However, people with mental illnesses do have jobs, go to schools, and lead an active life in their communities. And if under treatment, they are usually seen to be doing well. 8. Myth. People with mental disorders are dangerous and violent. Fact. Research has shown that people diagnosed with a mental illness are subjected to violence and crime rather than being violent themselves. The onset of a mental illness is associated with a heightened risk of subjection to violent and non-violent crimes. 9. Myth. Only positive thoughts and prayer can heal a mental illness. Fact. Prayer, positive thinking, and spirituality can be used as effective tools for recovery, however, these are not the only tools. Lifetime recovery can be ensured by integrating these tools with proper medication, therapy, and self-care. For this, one must talk to a licensed mental health therapist or seek treatment in a residential mental health treatment center, if the condition is severe. Myth. People with mental illnesses should be kept in institutions. Fact. People with severe mental illnesses or psychosis need to be institutionalized. The rest can stay in an inpatient mental health treatment center for the period of time of their treatment. With advancement in medical science, it is now possible for people to live with their families, secure a job, have a social life, and live a life well, while still being in treatment. A certified mental health therapist can diagnose the severity of the condition and help one ascertain their options. Seeking help for mental disorders. Mental illnesses are real, and if left untreated, they can affect each and every area of one's life. They can affect school or work performance, relationships, and can also cause suicidal ideation. Overall, these problems worsen the quality of life. Therefore, it is important to receive a diagnosis and early treatment.